Hello and welcome to the Real Health Conversations podcast. I'm with my co-host Leah today. Hi, Leah.
Hi, Holly. Hi, everyone.
And we have Dr. Don Clum back with us in the studio. Hi, Dr. Don. How are you?
Good. How you doing? I love the
Good.
studio.
I know this is our virtual studio. We have had Dr. Clum on before in the past, but if you did not catch that episode number 434, I will do a brief little intro for him real fast. Dr. Clum is a chiropractor. He is a specialist in advanced metabolic nutrition. He has a really amazing integrative program for insulin resistance where he specifically focuses on diabetes prevention, metabolic syndrome, weight loss resistance, obesity, cardiometabolic issues, all those things lumped into one. So welcome back, Dr. Don.
Thank you for having me.
And we have you back today because we are talking about a new study that came out about Alzheimer's, and it has been rumored and talked about for years now that Alzheimer's is type 3 diabetes. And so we do want to get into that, and I want to have save plenty of time for it. But for our listeners that maybe did not catch your last episode or are not super familiar with you, could you please give us just like an overview of your experience, which I know is long, but let's highlight the specific stuff that would be relatable to this conversation.
Sure. Yeah. I got into insulin resistance because I started doing metabolic health. Basically, started with weight loss. I was out of the country, came back in, saw a big change in the weight after 10 years, and we wanted to avoid that for our family. We got into weight loss. That got us into obviously diabetes and some other weight related problems. And then I got a chance to do some studies with a big population health company on their people, thousands of people in these cohorts. And that's what really got me to dive in and learn the mechanics of the whole thing. And my whole position on it is physiology. What is happening in the body and why? And based on that, looking at all these different things. And when you do that, it backs up all the way to the individual cell. And in my world, all roads lead to insulin. And so that's how that emphasis came. And it grew from there. We did diabetes prevention studies, type 2 diabetes reversal studies, and a lot of case studies, cohorts, and things like that. So that's what brought me to this topic. And hopefully I'll be able to talk about what you wanted me to talk about too.
Yes, we'll definitely talk about all the things I want to talk about. You have a really great group program that I touched on a little bit. And so I think it's one of the best programs out there in terms of helping people improve their metabolic health. Do you want to share a little bit about your program and how that works and how people can find you?
Sure. Yeah. I have a 6-month signature program and it's all lifestyle based. What we've learned over the years, we have a lot of data on weight loss, heart disease, diabetes, and things like that for decades. And when you look at it, you realize that by managing them, or like lowering blood sugar in a diabetic, or blood pressure in someone with heart disease, or just some pounds off the scale with someone who's overweight, doesn't change their health outcome. They still get all the problems. Just now they have lower blood sugar, blood pressure, or weight, but all the problems in the shorter lifespan and the conditions still got there. So we started to look at it differently, right? And then we went down to the lifestyle base. That's what my program is based off of. The backbone is nutrition. We go over what to eat, but people can choose whatever genre of food they want. Well, it's not prescriptive. But then the main cadence and the main sequence is with the when you eat. When you eat, as in meal timing, meal spacing, and different ways you rotate your meals, intermittent fasting and other forms of modern day fasting. These all become more important than even what's on the plate when you look at it from a hormonal metabolic point of view. So our program is hormone based and is designed to reverse the problem that causes insulin resistance and then all these problems down the road. And when you look at it to actually reverse it versus just manage it, it has a whole different landscape. When you look at it from hormones versus say calories or carbs or macros, a whole new landscape. And so we had a whole opportunity to do something different, and it's been going very well. So it incorporates diet, exercise, sleep, stress resilience, and we try to work them all together so they all point in the same direction, because we're all doing those things anyway, right? We're moving or not, sleeping or not, eating or not, thinking or not. Let's just kind of line them up and make them work for us instead of against us. They can find me out on Facebook. Don Clum is my personal. My group is Insulin Friendly Fasting Secrets. It's based off my website, insulinfriendlyliving.com. And you can find me there far too often.
All right. I know you, it's like you're always online. I know you talk about the importance of sleep, but I'm pretty sure you don't ever sleep because every time I'm online, you're online.
This is what happens when you know the host, right? You get a little bit too much information coming out,
Okay, we'll edit that part out. Just kidding.
I'm sure.
Okay, well, we'll be sure to link up all your pages and where to find you in the show notes. So now I want to just dive right into it because I think we have a lot to cover. First, I'm gonna throw it to Leah because I think we're just gonna cover some basics here before we get into the hard hitting stuff.
That's right. And I just wanted to make a small correction to your beginning, Holly, where you said it was a new study. It's actually not a new study.
Oh.
It's 2 decades of Alzheimer's research that's basically being come out now. This is the new part, that it was deliberate fraud by the 2 scientists, and it's cost billions of dollars, millions of lives. So much is going on from that. So we're going to really dig into that article and talk a bit more about that and about some of the things coming out of that. But
Yeah,
what
thanks
I wanted
for that
to talk
clarification.
That's all right. But what I wanted to talk about first is Alzheimer's itself. So, and I got some statistics here. This is America, so sorry for my Australian listeners. I hate doing that, not giving, but I'm sure the stats are pretty similar. So in comparison, so an estimated 6.5 million Americans aged 65 and older are living with Alzheimer's in 2022, this year. So younger people may get Alzheimer's disease, but it's less common. But I think it's becoming more and more common. And the number of people living with the disease doubles every 5 years beyond the age of 65. The number is projected to nearly triple to 14 million people by 2060. So, the definition, they say, of Alzheimer's disease is a progressive neurological disorder that causes the brain to shrink and brain cells to die. Alzheimer's disease is the most common form of dementia, a continuous decline in thinking, behavioral, and social skills that affects a person's ability to function independently. So, I think when most people think of Alzheimer's, they just think it's like dementia, memory loss. They know somebody that's been impacted by it. So, Dr. Don, I'd love you to tell us a little bit about Alzheimer's and, what what the beliefs are around that, because a lot of people think of it as dementia, but then we also hear that it being labeled as type 3 diabetes. So could you tell us a little bit how it all comes to be like that?
Sure. Well, it is the most common form of dementia, of progressive dementia. We're talking about not just senior moments or forgetful things here and there. We're talking about a clear decline. And the way people describe it is they start to lose themselves. They lose their memory, they lose personality, and to the point where they can function somewhat with guidance, but they're not really the person they were, at least cognitively, that they were. And that's what makes it so scary. The number one fear in our older population here in the States is losing your ability, losing yourself in dementia. It's predicted, it's the most expensive health condition you can have, mainly because you need 24/7 watching people. This is, you hear the stories about people walking out of their home and going down the road or going to the coffee shop, but they're wearing their nightgown. That's all has to do with how the brain essentially breaks down or atrophies over time with this type of condition. It's called neurological because we see physical changes in the brain itself, and when they do, that's when they see those plaquings that are very classic for Alzheimer's, and that's part of what they talk about in the study. Similar to Parkinson's, which has a different kind of plaquing, different area, but the same kind of thing. The plaquing we've been assuming is a big part, or it's an effect of the changes going on that are also producing the cognitive decline. And it's very sad. It's very emotional. It's very difficult. So it's estimated that one case costs an average of $300,000, $200,000 a year just to maintain, right? And that's a lot of money because people don't. That's way above the average income here in the States. And so it's very expensive. It's very complicated. It's very emotional. It's a heavy one for sure. And so the reason they've been calling it for about 15 years now, they started calling Alzheimer's type 3 diabetes, is because of this one particular enzyme. The plaques in the brain form due to different reasons. We're not even sure why they form. Could be trauma, could be something not working inside, or miscommunication. We don't know. But when they form, there's an enzyme in the brain that's its job is to break it down, right? It's to break it down. And then we discovered that enzyme a good long time ago. But the problem was that enzyme did another thing. It also broke down insulin. So we found that first. So you got this funny enzyme, and we discover it, and we say, oh, look, it's breaking down insulin. That's its job. Great. Insulin degradation enzyme. And it kind of got put on the shelf. And then years later, we found out that the other job that I was talking about for insulin degradation enzyme is to break down the plaquing. We're like, oh, that's even more important depending on how you look at it. But it can only do one or the other. It can't do both. So insulin degradation enzyme will focus on insulin when there's high insulin or an overexposure of insulin in the brain, because it can become toxic and it can have major problems like a diabetic comas and all sorts of things. When it's doing that, it's not breaking down the plaques. When insulin is in a normal level, it's breaking down those plaques so that those tau plaquings and those amyloid plaquings that lead to Parkinson's, Alzheimer's, and other things don't form. They don't get into a problematic, it's like a recycling system. So what they know is that the formation of those plaques in Alzheimer's can only occur if that enzyme is focused on insulin. So it's a high state of insulin, distracting our self-defense to the plaquing, allowing it to build up, eventually causing the Alzheimer's. So that's a big part of the link. They said it's an insulin problem. It's a hyperinsulin problem that sounds like diabetes. And it also affects how the brain cells metabolize, use energy. And so that there's part of that too. But that was the big, I think the big aha moment when they connected to was because the enzyme, insulin degradation enzyme, was actually the responsible for breaking down the plaques, and it wasn't.
So just going back to something that may be causing that in someone's life. So we know that it seems to happen more prevalently in older people, but can it be happening from a long time because it's a slow kind of increase in the decline? And would it be like, so many people have this assumption that it's, caused from aging, but it's really not causing from aging. Is this like lifestyle factors that people are, high sugar, high stress, all those things? Is that from a life of that? And then when these people are like retiring or stopping, that's when the decline is starting to happen. Is that what we're seeing in the types of patterns with people with Alzheimer's?
Well, if you go back to the concept of insulin, you can think of those plaques as like a scar tissue. There's scarring going on in the brain, just like it happens in the liver. When we get fatty liver, get cirrhosis, there's scarring on the liver, destroys it. The same thing in the pancreas for type 2 diabetes, and in other places. We can get in the muscle, and we can have it's just this tissue is starting to go bad, basically. It starts to plaque. But that plaquing can only form in one state of the body. So the body has to be in this state in order for those to even form. They can't. It's called the fed state. There's a fed state and there's a fasted state. They're different mechanisms in the body. In the fed state is when things are being built like that, and that's when we can put on weight. You can't put on body weight, like body fat, unless you're in the fed state, right? That's what that state does. And insulin is the gatekeeper, the guardian for that state. So it also comes back to that. Whereas the fasting state is where we do all our recycling and cleanup, because we don't have food coming in. We're fasting, it cleans up, and that breaks down those plaques, body fat, and other tissues that need to be broken down in the body. And so what causes this, we don't know if there's a linear cause and effect with different things, but we know we have to be in that fed state a lot for it to even form. So if we start there, we have a whole different way of approaching it than if we wait till we have plaquing, detectable memory issues, and now we're down the line treating it. So if we can keep the body more in the fasted state, where it's recycling all those plaques before they form, including cancer cells before they're even precancer cells, then they don't get anywhere to cause that problem. And so that's where I think of the problem starting. So in that sense, yeah, it could start from childhood, because that by being dominant in that fed state all the time, we're just setting the stage for that and much more. That's why all these conditions are so prevalent, and they're so linear. Once they start, you can plot them out on a map for different people. Why? Because it's the same process. It's the same process.
Yeah. So we're spending we can assume that we're spending too much time in the fed state, which is then causing this to happen. So so logically, we'd love to be doing any preventative that we can, anything that we can prevent it now. But a lot of the studies that are looking into Alzheimer's are looking into drugs that can help try and stop this problem. So the article that we're referring to has had some issues here with the drug that has had some fraudulent testing happen. The scientists are being fraudulently doctoring the results and pictures of the results as well, which was found by another scientist. So Holly, I'm going to just hand over to you to introduce this article in.
Sorry, I was on mute there. Yes, so this article is in Science Magazine. It is very long and very sciencey. So we were discussing a little bit before going on. If you're having trouble falling asleep, this is a good one to read. But basically, what it's saying, as Leah said, is that yeah, there's some questions that are being raised about the history of the studies and where the research has been going with Alzheimer's. And honestly, it kind of lost me. So I'm going to throw it to you, Dr. Don, as the expert. What is the issue that it's finding here with the research, and what's that telling us?
Well, the inherent possibility of problems with the research is the same with any study of this kind. They're big studies. They're boiling it down to numbers. Numbers can be, all you have to do is switch a number or a decimal point, and you got a whole different outcome. And so another problem is when you compare it to big studies that use a lot of people, population based, they're very they're you can find whatever you're looking for. This is not that kind of study, and that's what some of the criticism was earlier this year on this study. But they were comparing the wrong things, right? So you got to know what this is supposed to be studying. It was studying and doing research for a drug. It was a linear cause and effect, and so some of the extrapolation is where it gets gray, as far as I see. But if you look again, the bottom line is we're talking about one of the biggest problems heading our way in our healthcare world, in our society. And if we wait till it's treatable, which is what this study does, because you have to have detectable levels, you have to qualify. It's already there. The process is already on. You're trying to slow it or mediate it, but there's nothing about reversing it or about preventing it. And so I think if we have the opportunity to acknowledge, I hope they do find something to treat it once it's there. But I think there's a lot of opportunity to create the body in a state that it'll never get there, that it won't ever have to be a concern. You won't qualify for those type of treatments. Does that make sense?
Yeah, so it's not necessarily that there's anything sinister going on, but there's not always right or wrong answers in science. It's we think this might be this, and we go down that path. So maybe we've just been looking down the wrong path for a while. It's not that anyone was trying to falsify. I mean, I don't know. I'm not putting
Well, we have
words
to
into
give them the
anyone's
benefit of
mouth,
the
but
doubt. I think
right.
because I mean, when you do a study like this, the studies science is very, very specific. They test one thing in one area for one outcome, and then we read that, and then we say, well, look, that means this over here. They're not set up like that. That's when we get into trouble. And so sometimes when you take the numbers out of context, even though it might seem logical, there's controversy. And
Yeah.
so, don't look to the studies to be telling you cause or effect or like cures. They're just one bit of more information. We have to understand how the body works and what that bit of information, where it fits. Otherwise, it's all interpretable, and we get a lot of discourse over it.
Yeah, and so maybe the important thing to focus on here is maybe not there being any shame around maybe we weren't right or maybe we got it wrong, but the more important thing is, what do we need to do to make it right? What questions do we need to be asking that's better, and what can we be doing to get the education out that people need so that we can be making changes earlier on in life instead of trying to correct course after it's been too late.
Yeah, because we can go through the study and we can talk about it, but I don't think leaving the discussion is going to give us much. What do we do? So what? Great, that's interesting. Cool, bad, good, ugly, doesn't matter. Let's look at, because they brought up a lot of great things about the metabolism of the brain and how insulin is impacting it. They were questioning some things, and that's fine too. But the bottom line is, there's a lot more involved than just plaquing, because a lot of people just still think that plaque just somehow gets stuck in there, or that is
Right.
genetic, that is just it happens because it's predestined. And that study is illustrating that it's not. If nothing else, you
I'm
can see it's not, that something is causing it.
Yeah, and I'm really glad you brought that up because that was going to be something I asked because
I have a long family history of dementia and Alzheimer's. My husband does as well. I know I'm not the only one, just looking at the stats of across the world with people with these type of conditions in their family.
thing to given someone like me or other people that have conditions like this in their family, is this something that we just have to go, oh, well, when I get old, this is what's going to happen because that's what happens in my family? Or what are some things that we can start doing ahead of time to change that course? I know you touched on it a little bit, but what else? What can we be doing?
The bottom line is, we're all one family. To look at it like my family, their family, we all have the same genetic predisposition. The difference between two is so small. And if you still have to activate these things. You can have the BRCA gene for breast cancer, but there's been millions of people who've had it all their life and never knew it and never had a problem. Right? It doesn't mean something's going to happen. And we're so young in our knowledge about how genetic testing and all this means. I wouldn't bank on any of it. What we do know is the body responds to its environment, and the response gets judged as healthy or not healthy. That's the outcome. It's the expression of how we're living in our environment. Things like diabetes, we call them a disease, but they're really not. Diabetes, metabolic syndrome, pre-diabetes, insulin syndrome, the insulin resistance, they are normal states of the body. That's a normal expression of the body. It's designed to do that under certain circumstances, to protect us, to do something for us. So for example, in diabetes, metabolic syndrome, all that area, we see it in other animals and things in nature. We see bears get metabolic syndrome and diabetes before they hibernate, because that's what enables them to pack on a certain kind of fat in their body so they get through the hibernation. Right? Birds do it before they migrate, go a long distance. They have to get through that long flight. Fish do it before they have, some fish have seasons of dormancy where they don't eat, or they're half asleep type of thing, and that's how they prepare. We respond to a certain action, we develop it to get us through things like the winter, things like times where we have less food. Evolutionarily, that saved our life. The problem is, we turn that on to get ready to do something, we never do something, and we stay in that state, and eventually it breaks down. So if the body is doing this for a reason, and there's a mechanism for it, then there's a mechanism to reverse it too. It's not meant to stay there, so it can come out. And that's what we need to focus on. That's where lifestyle comes back in play, because if you maintain that healthy expression, you never stay in that state. You don't have the possibility, you disqualify for the statistics that are out there for the American Standard of Health, which are terrible, right? They're very, very bad. And so that's what we talk about. And you can do it through lifestyle. So what can we do? We're already doing everything we need to do. We're just not doing it the right way, right? We're already breathing. We're already walking. We're moving or not moving. We talked about this. We're already sleeping or not sleeping. We're already eating or not eating, thinking or not thinking. We just want to line them up with the best efforts we can to push them all in the right direction. For in the direction we push is optimal function, right? We don't have to treat or fix anything. We just have to let the body work as best it can. So the health and the body needs no help. Healing needs no help. It needs no interference. It's a very different way of looking at it. And that's why I'm going into detail. And if that's our focus, then you can literally have a whole different scenario and not go down those paths.
So do you think fasting always has to play a role in that, or can we focus on other things? Or is fasting
No,
an integral part in maintaining or achieving optimal function?
yeah, it is. We're programmed to fast. It's a mechanism that it's almost like the body assumes we will, but we don't. And so it does things thinking that we're going to fast, and we don't. And so things get messed up that way. We talked about the state of the body. There's the fed state when we're eating, we are processing food. There's a fasting state when we're not. fed and fasted. They are 100% vital, both of them, but they're not 50-50 partners. Okay. You want to be in a little bit of fed and a lot of fasted. We also call the fasted the repair state. You got to think of the fasted state as when your body goes through all its recycling. It gets rid of the broken parts, the parts that aren't working. It tells the cells that have overstayed their welcome that they need to retire now, right? And so that enables turnover. So that's when people think of growth, like as healing or getting stronger, or in that's when that stage gets set. And if we're not in the repair state much at all, we never go through that process. Things just build up. Things build up. We don't recycle. What happens in your house if you don't recycle? Or take out just forget recycling, take out the garbage, right? A couple days, gotta stack it up. What about a couple weeks now? You gotta stick it in places. It wrecks everything. Same thing in our body. We've got a lot of stuff that doesn't have to be there because we never go into the recycling stage to get it out. Fasting does that. It's a tone of the body. It's a state. It's got different hormones that regulate it. For example, we talked about insulin. Insulin is for fed. It does a whole different bunch of stuff that we need. When that's turned off, insulin is low. No more insulin. Then we go over to things like growth hormone, human growth hormone, which is our fountain of youth hormone. It's our regeneration hormone, our strength or building hormone. That's when our immune system resets. That's when our brain detoxifies. That's when all these different things happen. We need both. And so optimal function becomes, how do we live our life in a way that allows those two to live the way they're supposed to?
There's a lot of resistance when conversations go towards fasting, and it could be resistance from anyone, say, consuming a standard American or Australian diet, to people who maybe eat healthfully but have hormonal imbalances or thyroid problems. I mean, Leah and I have had all sorts of types of guests on this show in the past talking about fasting, and we've probably had dozens of guests talking about when fasting is dangerous or when you shouldn't fast and stuff. Is there anything like off the top of your head or that you think is important to share about specific categories or types of people that should not fast?
In today's world, fasting is more natural than eating. The things that are on our plate and in our diet are so artificial. Most people will be safer not eating than eating. You hear that with kids. Well, I'd rather him eat junk than not eat at all. It's better than nothing at all. No, actually, that was probably better to skip that meal, right? The average American, the most nutrition their body processes happens when they're not eating, because of all the interference that comes with all the junk that when they are eating. So fasting is very natural. Your body's designed to do it. It's totally safe. What makes it unsafe potentially are the things that we've done to our environment. So like medications, for example, is where I'm going. Medication, you're on certain medications and you're fasting, that can cause some strange reactions, issues, and you want to watch it. Things like anything that lowers blood sugar, you want to watch it. As soon as you start fasting, your blood sugar lowers automatically. Now you're on a drug that does it too. You can bottom out, right? Or any hormones, same thing. Your body will start working better almost instantly when it hits the fasted state. Therefore, it'll process things, so you can become over medicated very, very quickly if you're not in discussion with your prescriber. But fasting alone, as far as risk, there's really not a lot of inherent risk any more than there is not eating while you sleep. Right? People talk about fasting as the starvation state. That doesn't exist. That's made up somewhere. Someone's arguing to eat, and they talk. You're going to go into starvation. Your body's going to eat itself. Starvation is a very severe pathological state, and no one ever has done it voluntarily, or very rarely. You have to like take someone captive and hold food away from until they die from starvation. That's starvation. Fasting is no more starvation than drinking water is drowning, right? They both have to do with water, but no one would think you're going to drown because you have a glass of water. It's just not the same thing. But we need to. But we have a lot of connections with food. People don't want to give up their food. People are addicted to food, and so that's their argument. But this fasting is very safe. You still should get some help. A lot of things come up. People are unfamiliar with what it feels like to not be fed all the time. And so there's good reason to get help, but it's, as far as it being dangerous, it's really not.
It's really interesting. I wanted to draw the conversation just back to Alzheimer's for a moment. We talked about preventing, or, things we can do to try and, lifestyle factors to try and prevent getting Alzheimer's. But what about if we've already got the progression starting? Do you believe that we're able to maybe then come into perhaps a fasted state from time to time when we get the early onset of it, to try and help prevent it deteriorating further? Or is it, like you were talking about before, once you can pinpoint it, just starts happening one after the other?
It depends on the damage that's done, right? It's really depends on the damage. Like, I work with diabetics who've been diabetic for 15, 20 years and on medications. They have a different process to reverse that condition than someone who just got diagnosed with pre-diabetes this month. It's not about their age, it's about how long has that been locked in there. But that said, I've had plenty 20-year diabetics completely reverse the condition. And I'm not talking about just lowering blood sugar. That's very important, because people do that all the time and they think they reverse their condition, and they haven't, and they're going to get hit by the same problems. And it's going to be devastating, right? So in order to reverse the condition, you have to change how the body is working. Not just the blood sugar is a symptom. It's a sign that there's change. It's not what the problem is, right? So in order to do that, you have to get the fat in the tissue, like scar tissue, out of the liver and the pancreas. Same kind of stuff that happens in the brain. You got to build up your capacity in your muscles for energy storing. You have to change your cells back that make insulin, right? You have to do all of these things in order, and you have to get some of the carriers that move all these things around back, because all these things get damaged. If you can reverse that damage, then yeah, you can. I wouldn't use it. I don't like the treatment model, like, because here's what'll happen. Someone will see this, they'll message me, how long do I have to fast to get rid of this plaque? How long do I have to fast to get rid of my ulcer? What's the protocol to get rid of my knee pain? It doesn't work like that. But the body prioritizes. The body's very smart. I mean, it's beyond our comprehension. When we're fasting and that hyper recycling kicks in, it doesn't clean things up randomly. It goes to the places that need it first, like the fat in the liver, like the fat in the muscle, like the fat, which is a plaque, is a fat formation scar in the brain, and it takes care of that first. So is it possible? I say absolutely. Should people who are at that point try it? I said absolutely. Nothing else has ever been shown to even come close. So what's the downside other than giving up maybe a food you like? I don't know.
Yeah, that's so true. It's, well, I would think that either myself or someone in my family, if they were heading down that path, I'd be wanting to try anything. And if fasting is a method that can be used, or a tool in the toolkit that can be used to help in some way, it definitely doesn't seem like it's a very difficult choice to make, does it?
It depends on where you'd be surprised. I've seen people, type 2 diabetics, even after an amputation, not willing to make a change. We've all seen the commercials with the trach and the smoker, right? It's just, I don't know. I'd like to think so. I like to think that I can show people how they can detect this problem 10 years before their blood sugar even changes, and that would be enough. Not always. But for the person who's ready and wants to make the change and wants to get better, yeah, there's a whole lot of possibility there. But you can't make anyone do it, like anything else, right? You can't want them to be better more than they want to be better. It's tough. You can't eat my salad just like I can't do your workout, right? We have to be, that all has to be in us.
Definitely. How do you motivate your patients when you're working with them to make that change, or do they come to you already knowing that they need to make a change?
Well, two things. One, the motivation starts with me. That's the question. How do I motivate myself to make sure I stay to what we're learning here, right? It's the same as anybody else. I'm no different, right? We have ebbs and flows, ups and downs. So it's kind of universal, but something within us makes us value that at some point. Like, why is today different than yesterday? And what made it different than last year? If you can figure that out, I'll sign me up, because that's the golden ticket right there. But people come to me. No one comes to me first. Nobody wants to start with fasting, right? They're like, they've gone through every door on the house and I'm the last one. And like, oh, I guess the only light left. I understand that. But when they get there, people know, especially if they've gone the medical route and they get no answers. They get patronized, they get talked down to, or they get ignored. They get told that, no, nothing's wrong with you. And then even worse, it's in your head. or they do a weight loss program through the government, through their doctor, and they follow it, and they don't lose weight or they get worse. And they go to their doctor and they say, I did the program. Well, you must not have, because you didn't lose the weight. So you did something wrong and it's your fault. No, that system is wrong. When people succeed on a conventional diet program and don't lose weight, that's a success because the program is wrong. That's the only outcome. And we know that now. We've been doing it for 60 years, yet we put it on the person. So one of my first suggestions is, if you're going to do something and you've done it before and didn't work, do something different. Do it differently. That's step one. Think about it differently, do it differently. Because if you do the same thing, I don't know why we think it is gonna come out differently.
With that note, I want to also tie that into something you said earlier about how our body is really smart, and then when it starts repairing itself, it's going to start repairing itself on those organs that are important. And maybe if someone is going to take on a lifestyle where we are doing more insulin friendly type of food and lifestyle changes, but people just want to see weight come off, or people want to like see physical symptoms subside, or they want to see relief in certain things. So you're talking about things that we cannot always physically see or physically feel. So I can see on one hand people saying, oh, well, that didn't work for me, and maybe not going back to trying something like that. But and I know there's not a quick answer of like how long someone needs to try something to start seeing results. And so I guess maybe what kind of encouragement can we give to people who are maybe trying something new and making changes and not seeing maybe the physical benefits of their changes? Are there specific blood tests they should be? I know you can't give like general stuff, but what kind of markers could people be looking at to maybe get a picture of what's happening on the inside that they might not be able to see with their eyeballs?
There's a lot of questions in that question.
I know. Sorry, and I was rambling.
Well, okay, we'll start with how do I know if I have a problem with this, right? If you've gone up and down in weight more than, depending on your size, 5% of your body weight in fat, then there's a problem. There's going to be an insulin resistant problem because it's starting to change that way. If you've gained weight and you want to lose weight and you do what you usually do and it doesn't work, that's a problem. It's called weight loss resistance, or you get worse. Or if test you can do at home, you get a Taylor's tape measure and just go around your belly button. Just keep it flat, go around your belly button. If you're 35 inches for a woman or higher, that's a positive indicator of metabolic syndrome. You got visceral fat, something on the insides, not well. If you're 40 inches over as a man, same thing. Now that's metabolic syndrome criteria. If you wanted to say insulin resistance, go to 33.5 for a woman and 38 for a man. Because you have insulin resistance before you have fatty liver and everything else and metabolic syndrome, type 2 diabetes down the road. You can identify it. So if you don't need the hip, you don't need all the measurements, just you're around your waist. That's got great data. Okay, great data, best there is. If you want to test, just if you go take a vitamin D test, you can now in the States, depending on the state, you can get them sent to your house, and they're much cheaper than they used to be, and you probably can get it on your next physical, but you might have to ask for it. Vitamin D, if your vitamin D is low or anywhere near low, you have insulin resistance. Because insulin resistance and vitamin D work on a teeter-totter. When one goes up, the other goes down. If insulin resistance is up, that vitamin D number cannot come up, even if you're taking supplements, even if you're in the sun every day.
Are there two different tests for vitamin D? Like, I feel like there's like
they just go get the standard
active and reserves.
Either one, because we're not doing diagnosis, right? If your vitamin D indicator is down, you got insulin resistance is what keeps it down. Otherwise, vitamin D can stay up even if you're not in the sun most of the year if your insulin resistance is low. It's very interesting. You don't have to do all these things that people do just to keep a normal level. If they're doing that, if you need to do all that, you got the insulin resistance holding it back. That holds it back. And taking a lot of D won't lower the insulin resistance. The insulin's a bully on the playground. Think of a bully holding down another kid. That's vitamin D, and the bully's just right there. That kid's not getting up until that bully takes his hand off, and that's insulin resistance. Right. But if you lower insulin resistance, that D will come up without needing supplementation or extra sun or any big efforts. Now, the sun is good. I'm not saying don't get it, but I'm saying you don't have to. And if you want to know your vitamin D level, you better be off your supplement for at least 60 days, right? Otherwise,
Wow.
you're just testing a supplemented number, right? And that might give you a false sense of security. You want another test that you probably already have, go to your old test. You can look at your triglycerides. If it's over 150 in this American standard, sorry, Australia, if it's over 150, then it's metabolic positive. If it's over 100, you can assume it's insulin resistance. Everyone has those. If your HDL is low, same thing, right? If your LDLs go up, same thing, because LDLs are formed in the body in the fed state. They're not from our food. They're made by the liver in our body for our body, but the switch is insulin. It has to be insulin there to form them. No insulin there, they won't form. The numbers will stay low. They can't go high, right? Certain things can happen in different states because of the hormones that are dominant. Okay, fat formation, body fat, liver fat, scar tissue, amyloid, plaquing, all need an insulin dominant state because that's the switch. Without it, they can't form. That's why Thomas Seyfried, who wrote the medical textbook, Cancer as a Metabolic Disease, he said 1 7-day fast a year will eliminate over 97% of new cancers from even forming. Why? Because they're not even precancerous yet. They get picked up in the recycling system from the fast. They don't have a chance to grow up and to be something else. Right? That recycling system is powerful. Think of that as your healing system. You don't heal in the fed state. You don't. People say, "Oh, eat. You need your strength to get well." No, you don't. What do animals do when they're hurt?
They don't eat.
If they're sick, but watch them. If they ever hurt their leg, so they didn't hurt, they're not sick. They still don't eat. Right? They take the time. It's really interesting, and I think we can learn from that because even when we get injured, we roll an ankle. We're taught in medical school and in every health class there is, the body puts down scar tissue to stabilize it, and it puts down an overabundance, and that can be a problem. That's why they use ice, right? And that's true, but I think that's because in nature we wouldn't move and we wouldn't eat for a while, and the body would clean up what it didn't need. But in the modern day, it never cleans it up, and it stays, and we get this overproduction of scar tissue, limited range of motion, increased pain, and the whole thing. We've had people start to do my program, go through the fasting, who had a spinal surgery 10 years ago. And suddenly they got range of motion. All this stuff is starting to change because the body's finally picking up some of that scar tissue. So
I feel like that could be a whole separate episode because this is fascinating. I didn't anticipate our conversation of Alzheimer's going into repairing scar tissue throughout the body and fasting. But I think that's one of my favorite things of talking to you because you're just so full of information and we never know where the conversation is going to go.
But one way to look at this is look at the plaquing and even look at cancer as an intelligent thing that's there for a reason. If you start to look at it that way, everything looks different. Rather than something that's happening to you and that's killing you or whatever you want to think of, be thankful for it and say, why would that form? What's the benefit? It's hard sometimes, but when you see that, now you see how it works together, and you can
kind of froze on us there. Leah, can you see me normally?
Yeah, I can. Yeah.
Okay. Oh no. Okay. Well, it looks like we lost Dr. Don there at the end, unfortunately. But that was a very informative educational conversation. I'm so glad we were able to touch on this topic. I will be sure to link up all of his links and anything that he mentioned throughout this episode into the show notes so you can find it. And that is it for this week's episode. Our theme music is created by Andrew Bowden and production services are by Kevin Kennedy Spain of Disc of Light Media. Have a great week, everyone. And thank you,
Have a
Dr.
great week.
Don.